So this is our ALS bag, our advanced life support. Providers will use this bag on calls in addition to the BLS bag that we went over. The first pocket here has our IV stuff, which is intravenous. So when you go to the hospital and have lab drawn, it's the same thing, but just leaving a little straw in your arm so we can give medications and kind of use that line. There's different setups for putting the IVs together, as well as some gauze, alcohol, different cleaning. We have different size needles depending on what we need to use. We also carry some meds in here. This one's aspirin, so if you were having a heart attack, we would give you some of those. Zofran, so a medication if you're nauseous, and nitroglycerin, which is another medication that's used with some cardiac conditions. Once we start the IV, if we needed to give you fluids for any reason, like you were dehydrated, we keep our fluids over here. We have a liter bag as well as various smaller bags for mixing medications. We also have another contraption for if we need to give you fluid very quickly. This is a pressure bag, so we put the fluid in there, and then we have a little bulb that helps it tighten up, and we can inflate it. This next portion is airway devices. So the first thing we have is a nebulizer. So if you know anyone with asthma, this is something that they probably have used in the past. We have albuterol and Atrovent, which are two medications that kind of help the airways open up and move air better. We would connect back to oxygen, so they're also getting oxygen through it. This other device is called our CPAP device, so similarly to maybe how you've heard people with sleep apnea, but we can use this for other medical conditions, like if there's fluid in lungs, we can put this on the patient and it'll help to push that fluid back out of their lungs. This is for someone that's conscious. If they become unconscious, then we have to think about other ways to manage their airway, which is where this pocket comes in handy. There's specific paramedics that are able to deeply sedate and paralyze people so that we can put a tube down your throat so that we can help you breathe. These are the medications specifically for that. We keep them cold and change it every shift, the cold pack, because they have to remain at a certain temperature. Also in here for mostly unconscious patients is our IO. This is a device that we can actually access the intraosseous space, which is in someone's bone. So in the event that we wouldn't be able to get an IV, we would use this. There's a little drill here, so we connect that to our needle. We use, this is our smallest needle for, and we just connect it right in there, and the drill would be able to help drive it into the bone rapidly. The next part that we have here is our main portion. We have kind of the gauntlet of drugs in here. So we have some sodium bicarb. These are for different states like acidosis. Then we have some glucose. So if someone's blood sugar is low and they're still able to swallow, we can give them glucose and bring up their blood sugar without having to start an IV or give them anything else. We have another nebulizer kit here. This is for if we had someone intubated, we can attach that to the tube and a BVM. Our first thing that I want to show you is our ET kit, or our intubation, like I talked about before. This is so in here we have our device for looking down someone's airway. So it has a little light on it, and we just insert it into the airway and we're able to see the vocal cords. With that device, then we pass a tube or a introductory device in there to be able to then slide the tube over top of it and place this so we can breathe for the patient. Then we also have a device that goes along with that, and it's called our Capno. And this we insert onto the tube, and it helps us see how those breathing patterns and the gases in the air that's being exchanged. This is a nasal cannula we've talked about before. Just goes in someone's nose while we're intubating, so we can still deliver them a decent amount of oxygen. We have some forceps, so if we were looking down your airway and there was a piece of food or an object in there, we could reach in there and grab that out of there. In the unfortunate case where there is an obstruction and we can't get it out, we have a scalpel in here to be able to find an alternate way to get that airway. We have different sizes of those blades over here. We also have some lubricant to make the tube slide down the throat more easily. And then in the event that someone had trauma or air or blood in their lung space that's kind of compressing their heart and their other lungs, we have longer needles that we're able to insert in between the ribs. So the next thing is the pediatric ET kit. So this is a lot of the same items, just smaller for children. Here's some of those fluids that we talked about. So this one's our 10% dextrose. So this, like the little tube we talked about before, is for diabetics. This would just be if you are unconscious or unable to swallow effectively. We don't want to give you something to swallow if you can't swallow. So we would start an IV and then give you some of that. We also have just another smaller bag of fluid for mixing up medications and different tubings for delivering them. This is our pre-filled medication kit. We have kind of our quick medications that we would give more rapidly. The first one you've probably heard of is Narcan or naloxone. This allows us to be able to give it via IV, so we can connect it to our IV and give a smaller dose, so it's a little bit more controlled of the reaction. You may also have seen these or heard of these with the nasal piece, so we have that option as well where we give a larger dose but up each side of someone's nose. We have lidocaine here, which serves as an antiarrhythmic, so if your heart was kind of in a weird pattern, we could give this and it would help to control it. We also can use this for some pain management. If we were to insert the IO that we talked about before, we can give a little bit of that and it helps with the pain. This one's calcium chloride. It's another medication to kind of counteract low calcium or other disease states such as diabetic acidosis. We have atropine here. This is for if your heart was going very slowly. We could push it and it would help to increase that rate for certain types of slow heart rhythms. And then all of these here are epinephrine. So this would be a medication that we would give in cardiac arrest. So this is our kind of our bigger dilution epinephrine. So we would just connect it to one of these tubes and could give it very rapidly in the event that someone goes into cardiac arrest. We have a few more medications here, just a couple. The first of which we have adenosine. So adenosine is one that works on the heart and it kind of helps to stop a very quick rhythm. So similarly to lidocaine, but this one works on different type of rhythms that we want to kind of stop or slow down. So these are these little vials. The next is our amio. So much more similar to lidocaine. This works on a lot of the same things that lidocaine would to change or convert those rhythms. Here we have glucagon. So these are in the unfortunate event that someone's blood sugar is low and we can't get an IV and obviously they're unable to swallow because they're unconscious. We could give them this into their muscle and this would help their liver to release any excess glucose and hopefully allow them to be conscious enough to be able to eat something. This is dexamethasone. It's a steroid that you may have heard of before, also Decadron, given in patients with asthma exacerbations, COPD, things that kind of help the inflammation. We also would give it in anaphylaxis or like an allergic reaction. The same with Benadryl. So this is diphenhydramine, your generic Benadryl, but we can give that IV or via the IM or intramuscular route. We also have these are our epinephrines for anaphylaxis. So this is a more concentrated dose because we're giving it into your muscle instead of into a vein. And we give a smaller dose of this as well. And then we have magnesium sulfate. So for low magnesium, also for patients that are pregnant and maybe having a seizure. We have Levophed, which is a pressor. So this helps for if our other techniques of improving blood pressures aren't working, we can kind of give that down the line to help with that. We have metoprolol, which is another agent to kind of control heart rate. So this is a rate control medication versus the antiarrhythmic. Then in here we have various types of syringes. We also have more atropine, or excuse me, albuterol and ipratropium, Atrovent. And that's it.